Welcome back. The Southern African Development Community is set to hold a joint meeting of the Ministers of Health and those responsible for HIV/AIDS on November 7th in Harare, Zimbabwe. This gathering will bring regional leaders together to address critical public health issues with a focus on improving the quality of life for people across Southern Africa. Now, joining us tonight to delve deeper into what we can expect from this important meeting is Namibia's Minister of Health and Social Services, Dr. Kalumbi Shangula. Dr. Shangula, good evening and welcome.
Good evening, and thank you very much.
Thank you so much for being here.
Yeah.
To start with, Dr. Shangula, talk to us about some of the main public health issues that the SADC Ministers of Health responsible for HIV and AIDS will be focusing on in this upcoming joint meeting taking place in November.
Yes, thank you very much. The joint meeting of SADC ministers responsible for health, HIV and AIDS will take place officially from it's actually taking place officially from the 4th to the 8th. There are quite a number of activities lined up. The first one would be the meeting of senior officials from the 4th to the 5th, and again a joint meeting of the senior official on the 6th. Then it will be followed by the meeting of the ministers responsible for health, HIV, and also ministers of finances are invited to take part. Mm-hmm. That will take place on the 8th, and then on the 7th, and then on the 8th, it will be the commemoration of SADC Malaria Day. Mm-hmm. So there are quite a number of, of issues to be dealt with. The first one, and most topical, is the emergency situation in Southern African Development mm-hmm. Community. As we might know that the SADC region has been afflicted by another of public health emergencies. After COVID, we had countries which have experienced cholera outbreak, mm-hmm. And there was a serious cholera outbreak in some of the SADC member states. Now that has been brought under control, but soon thereafter there has been an outbreak of mpox, especially affecting the eastern part of Democratic Republic of the Congo, which mm-hmm. is a member state of SADC. And after mpox, we also know that the region is afflicted by the drought, and the drought produced its own health emergencies. So the issue of public health emergencies and the countermeasures mm-hmm. will take center stage during this meeting. Mm-hmm. Apart from that, the meeting will also tackle the TB epidemic in the Southern Africa Development Community, more specifically to analyze the situation and to devise effective means to try to combat TB. And then there is also the case of malaria. Mm-hmm. Malaria is endemic in almost all the SADC member states with the exception of Lesotho. Now, Namibia is one of the countries which are earmarked for malaria elimination. There are 4 countries which are earmarked for malaria elimination, including Namibia. And all the other member states, they also strive to reach the stage where Namibia mm-hmm. is heading to. So there is that combined effort from member states to devise strategies that effective strategies should be implemented in all member states. Mm-hmm. That's the only way we can be able to control the malaria epidemic, because mosquitoes, they don't respect borders. They just come and bite from one country to another country. And therefore, it is very important that the SADC ministers responsible for health, they really take concrete steps aimed at elimination of malaria in the SADC region.
Speaking of effective strategies, what opportunities are there, Dr. Shangula, for the SADC region to enhance quality of life through better health policy coordination, particularly now in the HIV and AIDS prevention and treatment?
Yes, the most important thing to remember is when you have a public health emergency, one needs always to know how this disease is transmitted. What is the causative agent and how it's being transmitted. So you focus on those important points, the transmission, to cut the link that facilitates the transmission. That's the most important point. But it's not. It is easier said than done, because also this microorganism, they also try to survive. When you do this, they do the other way, because some of the conventional, health products we are using, they may also develop the resistance against them. So when they develop the resistance, then you have to change the strategy. So it is especially when, in terms of HIV/AIDS, what are the driving sectors? What are those which drive the propagation of the epidemic? And that is where you want to focus. But it is also important that when member states come together, they share best practice. This is how we did it, and this is the challenge we found, and this is how we can go about it. But one of the most important things within this meeting, I mentioned earlier that ministers responsible for finances, they are also invited.
I was going to ask the rationale behind inviting the ministers of finance.
Exactly, because all these measures, the countermeasures, they need funding. And the essence is that sometimes ministers responsible for finances may not have a deep appreciation of the nuances within the public health sector, especially when it comes to the countermeasures which are required.
Right.
Yeah, and also to give the understanding that investment in the health is not for nothing, because health ensures that the citizen are healthy, because if you don't have a healthy nation, there will be no economic development, there will be no progression. And it is actually on investment worth pursuing, first to ensure that your workforce is healthy, and then you can talk about socioeconomic development.
You mentioned earlier at the last day of this 4-day meeting on the 8th, of course, there'll be focus on the SADC Malaria Day. That's on the 8th of November. There'll also be the launch of the Zero Malaria Starts With Me campaign, I understand. How do these events contribute to the region's efforts in fighting malaria and improving public health?
Yes, because the essence of a malaria day is really to heighten the awareness. It's heightening the awareness not only within the health sector, but the public at large. And that's why these events, they are held as public events. They are not only confined to those who are working in the health sector, but it's public, so that all the messages can go out to say, we have this problem, this is how we think we will be able to overcome it.
Lastly, Dr. Shangula, what specific actions or outcomes do you hope will emerge from this review on the health landscape within the SADC region?
Well, there will be decisions and resolutions from the meeting of the ministers. That will be concluded on the 7th. And then there will be a public communique which will inform the public what has happened during that particular time and what are the way forward. One other thing which I didn't mention is that one of the focus in this meeting is malnutrition. Malnutrition is exacerbated by the drought as well.
Yes.
And also, when we talk about malnutrition, most people only think about undernutrition, lack of nutrition. But also the biggest epidemic we are facing in SADC is overweight.
And obesity.
Obesity. And those are difficult conditions which are big liability to the health sectors. Because when you have conditions like that, it's very, very difficult to put under control. So when we talk about malnutrition, we talk about both sides, where there is a lack of food and where there is an oversupply of food. And because both these epidemics, overnutrition and malnutrition, they all exist within the same communities.
Well, Dr. Shangula, we do appreciate your time this evening and joining us here.
Thank you very much.
Thank you so much.
It's always my pleasure to share with the public the information we have so that both of us can really ensure a healthy nation. It's not only the responsibility of the Ministry of Health, because each and every individual has a contribution to make.
Thank you so much. And safe travels to Harare.
Thank you.
Well, there you have it. We'll be back after this brief break. Do stay with us.